No, it will only show your LDL whole. Now, there is a different type of test that's more specific that you get, that any clinician can order for you, that gives the breakdown of the particle size, that can give you the not only the increase in particle size, but the actual average particle size, which we would like to see increased, and can break down the different populations of the LDL. But yes, if you get the standard lipid panel, it's going to show the exact same. In fact, it may show some increase, which will cause some clinicians to worry. It should not. Good question. Yes, ma'am.
If you already have damage to your arteries due to cholesterol, being on this diet, can you reverse the damage that's been done?
Yes, is the short answer. The main way that I say that is because it's really decreasing our inflammation totally. You know, coronary artery disease is a disease of inflammation. The less inflammation that we have in our body, the more that can be reversed over time. And there's been several different data points that have shown that you can reverse the coronary artery disease with diet alone. Several of them have done things like pure vegan-based diet, whole food, plant-based diet. But I think that that's maybe overshooting. I think we can probably do that with just low, refined, concentrated carbohydrates in and of themselves, and we can get that reversal. Yes, ma'am.
Dairy.
Yes.
I heard you mention cheese.
Yes.
It's okay. Milk. What is the?
This is where I start to verge a little bit away from the keto crowd, because I'm okay with dairy. You know, again, this comes into whether or not, so the things that we worry about that are, first of all, is it going to increase our weight? Well, again, that kind of comes to an individual person. Whether or not it's causing you to gain weight, well, then we can back off and see how that works. The other thing is whether or not it's healthy, whether it's causing us any of these other problems. Again, that gets to the inflammation thing. I don't think so. The data is mixed on that. Now, I will tell you, in our house, we eat cheese all the time. We do almond milk as opposed to regular milk, but that's just the way that we've gone about doing it, and those are the things that I prefer. I don't inherently have a problem with dairy. Slightly different than the keto diet.
If you do drink milk,
yes.
Do you have the whole milk then?
100% whole milk. Do not do low fat, do not do 2%, don't do skim. You do whole milk. No low fat anything. Low fat anything. Yes, ma'am.
There's a boatload of soy stuff out there that is supposed to be really good for you. Is that real? Is that different?
Yeah, great question. So soy products, so which you can get, the question was, of all the different varieties and cornucopia of soy products out there, are those actually healthy foods for you? That's a really good question. I don't particularly like to use the soy products myself. Now, you can use those. That tends to fall into this area of processing to me. Okay, so the more we're getting processed foods, the less that we're getting natural whole foods. So there have been some arguments either way about whether or not this is actually increasing your insulin levels. I don't want to get into that. I will say that in general, the more processed it is, the worse off it is for you. So I don't particularly like the soy products too much. Okay, great question. Yes, sir.
Oils, like olive oil or the other varieties of oils, they're fat. So listening to your speech, they're good for you.
100%. We should be using those
So
all
we
the
should
time.
load up on those oils.
We should be loading up on those, and that is okay. And you know, we had talked about the saturated fats a little bit, about how those don't cause coronary artery disease. And I kind of slipped one past you there, because the saturated fats absolutely cause coronary artery disease in the setting of at least a moderate level of carbohydrates. If we have those two together, that's the bad actor. So if you think of fried chicken here, if you take chicken and you cook it in oil and grease, that's actually not the bad part. The bad part is the breading, the flour. That's what we put on it. And when we have that together, that's the double whammy. That's the dangerous thing there. So the oil in and of itself, not that. We should actually increase that.
Follow up, is one oil better than another, or are they all equal? I know there's like 10 different oils. Sunflower, blah, blah, blah.
Exactly. And so there are plenty of people that will make claims about one being slightly better than the other. And again, this kind of goes back to my healthy fats versus unhealthy fats discussion. The truth is, I would just like you to eat more oil. Less carbohydrates, more oil. I don't really pick too much. We eat olive oil in our house quite a bit. That's our go-to. Thank you. Sure? Yes, ma'am.
Can you eat too much meat? Like if you are cutting down on the breads, but you want to pile on your plate because you're hungry, can you eat too much meat?
This is a very good question, because you start to worry, should I really establish some portion control? That's effectively what we're thinking about here. You know, if I'm going to eat this amount of meat, can I go hog wild? Can I have 14 steaks or something like that? The truth is, you can't eat that. If you really try, and this is kind of a hard process to intuit, we really can't eat eat our cells fat. You can't sit in one meal and eat through. You would stop long before then. I would venture to guess you cannot eat a significant number of steaks. You get tired of it very quickly. This is why on the ketogenic diet, I have never mentioned once portion control. Never mentioned once that you got to do 6 ounces of filet or anything like that. That portion control will come naturally. You cannot just eat meat. Now you can shove dessert on top of a full belly. That is something that we can do, and we all do it. But you can't shove more meat down your throat. You just won't do it. So, great question. Yes, ma'am.
Sorry.
That's all right.
So what you're saying is basically sounds like not just keto is what you're advising, which would be no carbs. You're advising having the healthy ones, like that's in fruit and dairy. So people wouldn't necessarily be in that ketosis state. They would just be eliminating those ones we have too much of. Is that what you're kind of promoting?
Effectively, what I am promoting is decreasing the refined carbohydrates. So I want natural carbohydrates that you would eat typically. Now, what I really want is patients to lose weight. I want them to be normal weight. I want their blood pressure to get normalized. I want their cholesterol to get a much more favorable profile. I don't really care how we get there. I think this is a great way for us to get there. And so that's when I say, if you love eating fruits and you just find you cannot lose weight, well then we'll talk about ways that you can come off of that. But in general, I think fruits have a lot of other phytochemicals and other things that could be antioxidants and may prevent other things like cancers that could be worthwhile. So that's why I don't take away those. Good question. Yes?
What about beans?
Beans, absolutely fine as far as I'm concerned. Now, you are going to have some that, again, will cause you to have a little bit more weight, that will have a little bit higher glycemic index, and I know I didn't speak about that, but in general, I am okay with beans. And we have there's plenty of databases that will give you some leeway on the ketogenic diet as to whether or not you can eat those things or whether or not they're going to affect you. The truth is, it kind of comes down to you. Some people, so for example, some people eat sweet potatoes, their blood sugar skyrockets. Other people has no effect on them whatsoever. So it becomes a little bit more individualized, and beans are one of those things. Yes.
Slim Fast has a new keto diet.
Yes. So she asked about Slim Fast having a ketogenic diet and ketogenic diet products. I don't like any keto shakes. I don't like any of the artificial ketones that you can get, keto pills. Any of that stuff, to me, is not the way that we should be going. We should be eating food. To me, the Nutri-Slim shakes, any of those kind of shake products, they're not really food. Now, I will tell you, I do drink protein shakes. That's after I work out. That's for a different process entirely. It has nothing to do with the ketosis. But I am always leery of these products that promise, no, you just take this shake for breakfast. Again, you're starting in, don't drink any sustenance. You should only drink to rehydrate. If you need sustenance, eat something. And then that something needs to be food, not some sort of processed thing. Great question, yes?
Do you think the USDA will ever be on board with this?
Yeah, I think it's impossible for them to continue. It is really a wonderful one. Honestly, and I don't see any representatives of the American Heart Association here, so that's good. The American Heart Association has been woefully behind in this. Absolutely just backwards in this. And still, if you look on their website, they're promoting this low-fat diet, and that's reprehensible in a lot of ways. So I think this is impossible because the zeitgeist of society is saying, wait a second, I'm losing a lot of weight here. I got off medications. My insulin levels are entirely down. I'm feeling a lot better. I'm getting more energy. Is this really bad for me overall? And then they kind of backtrack and say, well, we had all these, we're referring to studies from the 50s. So we're getting new studies now where we're trying things like high saturated fat diets alone, and we see you're actually having reversal of coronary artery disease. Counterintuitive, but so yes, I think it's inevitable they will have to. And we're going to blaze ahead. We're going to blaze our own trail here, okay? We don't need them to tell us what to do. Yes, sir.
Absolutely no artificial sweeteners, though. I mean, even on a small amount, or...
Well, again, that's going to be individualized. If you say that I actually have to have this, but think about what we're saying here, okay? You're saying, I just got to have that taste in my mouth. I'm trying to find anything that can give me that sweet taste in my mouth so I can feel it. We should be done with it. We don't need that sugar sweetness. Trust me, you don't need it. Now, our brains make us think that we do. We certainly want to feel like, no, I've got to have that pick-me-up. I got to have a Coke a day. All those things. No, they are lies that we tell ourselves. So in other words, once you find out that, hey, you know what, I'm just trying without any of the artificial sweeteners, you'll realize, man, those have been a hold on me for a long time, for no good reason. You don't need those sweeteners. Yes, ma'am. Great, fantastic. Okay. Okay. Well, so that may be the thing. That's what I'm saying. When we get down to our individual things, and just keep in mind, we're saying that, you know, I just put a little bit of sugar in this, and then this, it can cause that entire metabolic cascade that we had seen there, that totally mucks up the machinery. So try it without it. Again, I would bet you don't need that. And also, this is some anecdotal evidence, and I hear this all the time when couples come in to see me that say, like, well, he lost a ton, and I haven't lost anything. Life is not fair, ladies. I'm very sorry, okay? That is just not fair, and sometimes that will happen, but you're already saying success. So we know anecdotally this works. You can lose weight. The thing to get into our mind is whether or not this is healthy. Yes, ma'am.
You haven't really said anything about the non-starchy vegetables.
Yes.
So we're talking about a lot of salads and zucchini and non-starchy vegetables.
I didn't say a lot about that because the non-starchy vegetables, what those really have in them a lot is fiber. They're loaded with fiber. And again, fiber goes in the same way that it comes out. Fiber is going to count as a carbohydrate when you start to write that down in your diary. It's because it's made of a carbohydrate. It's just non-digested. So that's why you can't go a zero carb diet. That does not exist. That's impossible to do. But zero sugars is absolutely key. Again, much like the same argument that I have for fruit, I have the same with vegetables. I love vegetables. I eat them all the time. I think there's probably some anti-cancer properties of having fruits and vegetables that I like. Just get them fresh, cook them fresh. You will enjoy making these a lot more.
Fresh or frozen, because frozen is picked fresh and fresh frozen, so that there's no added salt or.
Yeah, you know, there's some.
Fresh could have been picked weeks ago.
Sure. So there's some really interesting data to suggest there's things like you have less of a insulin release if you boil a potato and then let it get back to room temperature. The number of times that you do that, so we can change some of the properties with them. I am a much dumber person than that. I mean, very simple. Fresh is always better to me, and I understand what you say about that. But you know, if you think about the products that we bought and the products that were created over the years in the interval aisles of the store there, they have a tremendous shelf life. You can put bread in the cabinet for weeks, and you can come back and it's still there. That's not the way food should be. Food should spoil, okay? So I actually like just getting fresh and doing that. The fresh vegetables probably would be okay. All right. Yes, ma'am.
What do you recommend about, I also started keto about January 1st. I've lost some weight, but the hair loss and like, as far as vitamins or electrolytes, or how do we get those when we're not?
Yeah, so this is a great question. It's about, how about multivitamins or supplements in general? What should we be doing whenever we do these keto diets? That should be individualized for you whenever you go to talk to your doctor. I will tell you from a data perspective, every single multivitamin trial we have ever done has failed miserably. Everyone that's to prevent coronary artery disease or cancer or to reestablish anything that we've lost from significant weight loss has always been a miserable failure. So working from the allopathic medical side, I can't promote any multivitamin or any specific vitamins, and you see it online all the time, and most of them are, I'm not going to say it, but they're not genuine, they're spurious, okay? So I would hesitate to not do those things. Now, the hair loss, those kind of things, that is true, that can happen. It's certainly not fun, and again, you can come talk to your doctor about individualizing. Maybe it's something like you could do carb cycling. Carb cycling is a way that where you have 5 days of no or very little carbs, you've got 1 day of okay carbs, and then 1 day of high carbs. Some bodybuilders are actually doing that nowadays, and it's to kind of shock your body and the insulin levels. I don't recommend that for a lot of people, but that might be one thing that could help. Okay?
So I'm a type 1 diabetic, and I've been type 1 diabetic for about 8 years. I take care of myself. I keep my A1C like in the 60s.
Right, that's right.
Thank you. So I hear the word keto my whole life, and it's bad to me, right? And so I what would you recommend? How would you, what do you say?
Okay, wonderful question. Okay, first of all, you should be commended. Keeping such control over your glucose levels is very, very difficult. So a type 1 diabetic is, I commend you. That's a great job. Okay, all right, so there's one dreaded complication of diabetes type 1, and it's called diabetic ketoacidosis. Diabetic ketoacidosis is an emergency. You're going to be going to the ICU whenever you come to the hospital. There is no doubt. Yes, that's great. That's great. Diabetic ketoacidosis is where you have too much blood sugar in your body, and so all of a sudden your body changes over its metabolism and you form ketones in a different pathway that is dangerous and could be very deadly in diabetics. This is an entirely different process. Entirely. You are forming ketones in this process from the ketogenic diet from burning fat. That is not what you are doing in diabetic ketoacidosis. This is not from your blood sugars being too high, like DKA or diabetic ketoacidosis. This is from your blood sugars being too low, and your body trying to replenish that with fat burning. It's actually converting fat into sugar for you. This is absolutely fine, and there are reams of data that suggest that there are doctors treating diabetic type 1, diabetes type 1 with ketogenic diets. It's not that you're ever going to get rid of diabetes with this because your pancreas is not making any insulin, but you can drastically decrease the insulin that you have. And therefore, and this is something to and I'm glad you brought this up, this is something to point out for even patients that are taking exogenous insulin. It doesn't matter where you're getting the insulin, if it's from your own pancreas, if it's from other pancreas that you're injecting into you. It still gives your body the same fat storage signal. So it's still giving you the bad actors that we had before, wherever you're getting the insulin from. So if we can decrease that, even in type 1 diabetics, that is going to do. Absolutely, you can do this, okay? Yes. Yes, Matt.
So I have 2 questions, if that's okay.
See if I can answer.
What research have you seen around the ketogenic diet and athletic performance, and specifically endurance performance? And then the second is maybe I'd love to hear your perspective on this, or the research that you've seen on this diet for females in terms of hormones, like the impact it has, especially during childbearing years.
Yeah, okay. Great questions. Okay, so first of all, athletic performance. The data is starting to come out because we have more athletes that are doing this now. So you have UFC athletes that are doing this alone. So what they've noticed here is that you don't have the sugar spikes that you had, so you don't necessarily have the energy spikes. We used to have this idea of carbo loading before a big race or something like that. That's really for Olympic-style athletes that are so honed, that have so low body fat that they're just churning through their energy very quickly. So athletes can actually get a performance enhancement with this alone. You're just having energy. That's all that they're feeling there. So the data is still coming out on that, but I think it's going to be absolutely fine for athletes to do this. Should be no increased risk at all. And remind me of the second thing that you asked. I'm sorry.
The second question is research around the impact of this diet on females' hormones, and then specifically during childbearing years. During childbearing years,
okay. Several things. So first of all, virtually all of the hormones that we have in our body, all of these things are made from one thing, and that is fats. The fat that we have in our body. So we're actually increasing that source, that supply for the building of these hormones and manufacture in our body. Much more than in a low-fat diet, as you might be able to intuit there. This is actually being promoted a little bit more, not full-on keto per se, but for women that have gestational diabetes. So it can actually be healthy for you to actually decrease your blood sugars even during gestation. Now, I think it's probably still, it is very rare that we do placebo-controlled trials on pregnant women. Nobody wants to find out anything that's bad with it. This is why the vast majority of the medications that we have are pregnancy category class C. Nobody wants to do this trial on women. So, and this one's going to be a little bit slower to come along. I don't see anything intuitively that would cause any sort of problem here. Although, in general, most of your obstetricians would recommend a little bit more of a balanced diet. But we can still do a balanced diet with having a drastic decrease in the carbohydrates that we typically use. Yes, sir?
Peanuts.
Yes.
Nuts.
I love them.
Nuts in general.
Yeah, nuts in general are really, really good because, again, they're high fat containing items. So the higher the fat that you have, the better off. Now, if you want to get down to the nitty-gritty of the interwebs and different people that are going to argue about these things, they may say that the macadamia nut is a little bit better, the peanut is a little bit worse for you because this comes into a good fat, bad fat kind of thing. I don't really get into that, okay? Now, if you're eating the peanuts and drinking a lot of beers every single night, then that may not be the thing that you want to do, because again, we're starting to combine carbohydrates and fats at that point. But the peanuts in and of themselves, absolutely fine with. I can tell you every single day that my snack food of choice is cashews. I have them virtually every single day. Yes, sir?
Hey, Don, the diseases that we have that are inflammatory wise, I think some of those fall in that category. Would this be a diet?
I don't see many disease processes that this can't be better for. This is kind of like saying, is it okay for me to lose weight if I've got fibromyalgia? Yeah, well, we can. And if you've got diabetes, you can lose weight. If you've got rheumatoid arthritis, you can lose weight. If you've got low back pain, you can lose weight. All of these things you can lose weight. As a matter of fact, the ketogenic diet actually goes back decades ago. It was started, I think, in the 30s and 40s, and it was for patients that had intractable seizures. This is the diet for seizure. If you have very low carbohydrates, you do not get seizure. Not exactly a clear mechanism as to why that is, but yeah, so there could be some specific esoteric disease that this may not work for, and we would talk about that. There are specific hyperlipidemias, familial hypercholesterolemias that we wouldn't want to do there, but that's a different subject for when you come talk. Great question. Yes,
I've been on the diet only about 6 weeks. I've lost about 6 pounds, but I've noticed that I get muscle cramps, so I bought some magnesium. Do I have to worry about the amount of magnesium that I'm taking?
So most of the supplementations that we take in terms of magnesium, in terms of electrolytes in general, if your body is not absorbing it, it will come out in your urine. So it's kind of hard to overdose on magnesium, believe it or not. Your body will get rid of any excess there. Now you have to introduce something. Some patients tend to have a little bit of muscle breakdown. It can go so far as to be rhabdomyolysis. Rhabdomyolysis is another word to prove to you that I went to medical school. So, but that is to say to you that, so sometimes there's some patients that this just doesn't work for. But either way, I commend you on losing weight so far, and we can maybe try and find that balance for the amount of carbohydrates that you can have that don't cause you to have those same kind of feelings, but still continue to lose weight. Right? Hi.
How would cortisol affect weight loss?
Well, cortisol affects weight loss more than anything else. So cortisol is a stress hormone that is produced in our body. Cortisol, for any of you that have maybe taken prednisone before, solumetrol, you know that you gain a lot of weight with that. That is inescapable. The reason that does is because cortisol is a stress hormone. What it wants your body to get ready for is to fight or flight. It wants to get you ready to run from a bear or punch a tiger. So your adrenaline levels will go up, but also what it does is it wants to get all of our resources available for you to utilize. So those resources in this case, it's going to free up sugar and it unloads a bunch of insulin. That insulin is the fat storage signal for you overall. So cortisol is a different animal in terms it is released under stress. So the less stress that you can have, the better off. Now, I happen to know where you work. So there are certainly things that we can do, and that's a different story, okay? So stress, happiness, meaning in our life, those are great topics, and I would stand here and verbosely talk your ear off for hours about all those things. We absolutely need to get the stress down in our life. And if you're going to have a significant amount of stress, this is the very likely mechanism with how that results in significant weight gain. So yes, get happier, make more money, be successful, all those things, okay? Yes, sir?
I haven't heard you say anything in conflict with Dennis Perlmutter's approach as a urologist. Did you have any comment about that?
I can't say that I'm familiar with that specifically, but you know, I will stand by what I'm saying here in general. The things that I really want you to take away from this, insulin releases the bad actor. It's not really that, here, I'll whisper to you, it's not really that I care that much about the sugars. I just really care about the insulin release more than anything. If we could stop that, that would be great, however we go about doing that. And the low fats are really bad actors. So we need to increase the fats in our lives, okay? There's no doubt about that. And we get a lot of benefits from that, and then certainly maybe in the urologic world as well. I will have to look at that, okay?
I don't know how to phrase this question. My wife is in a pre-diabetic condition. So for the last 70 days, we put ourselves on a diet with calories, which everybody does. now we're being introduced to this particular approach, which we both like. How do we equate that with counting our calories every day, or don't we have to do that anymore?
I would stop counting calories. The idea of calories in versus calories out, and if you burn more calories than you take in, that is true. But what it assumes there is that you're burning the same amount of calories every single day. The truth of that matter is that basal metabolic rate that I showed you in that pie chart, that's really where the bad actor is. And once we change from sugar to glucose, so in other words, if we just say a calorie is a calorie is a calorie, we're changing different diets. That molecular machinery, in order to get that processing and that metabolism going, takes a lot of energy, but it also slows down metabolism in a lot of different ways just to get that momentum change. So in other words, I don't like the idea of doing calorie counting. This is why I haven't given you any portion control. I haven't really mentioned calorie counting except for to derisively talk about it, okay? So if you go low carbohydrate, remember, this is the answer to reversing diabetes. And we talked about diabetes as a process. This is long before you get there. If you're pre-diabetic, absolutely this is the diet for you. Absolutely. This is how you stave off diabetes. This is how you reverse diabetes. This is how you never have to worry about diabetes. And if you were to talk to me of probably 2.5 years ago, that was my biggest fear. 1 in 2 adults have pre-diabetes right now. 1 in 2 adults have pre-diabetes right now. I thought, well, this was preordained. I could see the writing on the wall. I could see the epidemiologic statistics. That was what I was really worried about. I am no longer worried about that at all. Thank you. Any other questions for anyone? Yes, ma'am.
Can you recommend a good website for us to delve further?
Yeah, typically what I say is ketogenic.com has a boatload of information for us. Now there's one that is a paid site that my wife has found. It's called dietdoctor.com. Has a lot more information for it. It is a pay site, so what you can do is you can go there and pick out, it will give you individual meal plans. You can also pick out individual foods, and it will give you the glycemic index, the insulin release index, all kinds of things that you can do with those. So the Diet Doctor is what I recommend for if you want to pay for something. If you've got money burning a hole in your wallet. But if otherwise, a ketogenic diet, you're going to get a lot of this information. And then I happen to know you're a cardiologist, so I think that you could talk with him or her about that.
What about that Dr. Jockers? You got a few slides from.
Honestly, that's just some images that I've gotten from the internet. There's plenty of people that are ketogenic proponents. You can find a lot of that information. I typically, like I said, go to ketogenic.com. I typically refer my patients to ketogenic.com, or that Diet Doctor is a pretty good website. All right. I have talked your ear off. I really appreciate all your attention. You can always come talk to me at any time, and thank you very much for your time.